My name is Alessandra Mariano, and I'm a dental laboratory technician that works at the postgraduate dental clinic. If I were to tie the concept of infection control to something that I feel passionate about, it would be cooking, because I like to think that I wash my hands multiple times throughout the process. Similar to that, infection control considers how understanding a single lapse in the process can be a source of contamination. I know none of us are here want to hit food poisoning, so let's apply this to the concept of infection control. I want to talk about how this concept ties into the daily tasks of my job as a technician. I've been working here for the past 3 years and have briefed both doctors and technicians in my clinic, and even briefed one this morning. By the end of the speech, I'm hoping that my audience will be informed about how infection control affects the production of prosthetic devices for patients. From handling impressions to maintaining workstations and managing materials, infection control is woven into every corner of the laboratory. To start off, let's understand where a patient produces for us. Two initial things that we can receive from patient care are impressions and appliances. Prior to any handling, it's important to follow disinfection procedures, which in my clinic we have a strict one-way route to ensure that impressions and appliances directly go to the processing room. According to academicpath.org, there's clinical guidelines that follow for impressions to be cleared of any debris, saliva, and immersed for 5 to 10 minutes in a solution with 1 to 10 sodium hypochlorite. This ensures that there's 100% disinfection. This also applies for appliances, and they even have their own designated machines since doctors like to adjust during patient care. To ensure disinfection, we like to use Cavicide, and we follow the manufacturer's instructions to use 3 minutes of spraying prior to handling. Once disinfection is completed, both impressions and appliances can be rinsed and production can begin. While patient to lab contact starts here, infection control also considers how technicians can safely work throughout the case. No laboratory is 100% safe without personal protective equipment or PPE. According to the Occupational Safety and Health Administration (OSHA), there's a section for PPE called 1910.132, which highlights the use of gloves, masks, eye protection, and gowns, and in my case as a technician, smock tops. While these are mainly reserved for patient treatment, we also use them since we handle chemicals, impressions, and also deal with sterilization in the lab. When we deal with any contact with hazardous chemicals, all laboratories have a designated safety data sheets area. These are mandated by the International Hazard Communication Standard, IHCS, and structured based on the globally harmonized system. There are 16 sections that give you key information on treatment measures, technical scientific data, and even what is necessary for the substance to be in compliance. In addition to that, we also have different kits that allow us to safely dispose of foreign substances before they flow into the drains. We call these our designated spill kits, and we make sure they're easily accessible within the lab. Additional measures in terms of machines and equipment also include eye wash stations, shower heads, different equipment area signs, and weekly maintenance sheets that ensures that all areas are operational for use. While these are all further along the production process and it reduces the chances of us contracting anything from the patient, this does not fully eliminate the risk of cross-contamination. It's worth noting that many fields are going digital, and this does not remove dentistry. Computer-aided design and manufacturing, or CAD/CAM, requires understanding how to use materials, being able to inspect for material quality, and ensuring that we adhere to the manufacturer's instructions so that we can produce the right appliance. Mishaps in between processing can cause cross-contamination, which can irritate and even harm the patient. When dealing with 3D printing, we like to think about the concept of biocompatibility. Biocompatible resins, or different materials, can safely make contact with the patient without causing adverse reactions, according to Denpedia's dental directory definition. While a lot of digital printing happens even outside of dentistry, this just goes to show that it's become more prominent. Non-biocompatible materials are the opposite. They can't be placed into the patient because of their toxic properties and are instead used for producing physical models or even basically non-patient related things. To keep them separate, we have to have their own separate machines and equipment and even labeling them to ensure that nothing gets mixed up. This ensures that any material that was left over from the equipment does not pool into the next project, though it is a good habit to wipe down everything before using it so that it doesn't interfere with anything coming next. In conclusion, infection control plays a critical role in every stage of production. This isn't limited to a single step or a member handling the case. Understanding infection control considers safety from patient care to initial processing, which ensures that impressions and appliances are 100% disinfected. As the case is brought further into the laboratory, technicians have to know how to use safe practices for handling hazardous chemicals, being aware of where everything is so that they know how to properly use, dispose, and do care to prevent infection. Lastly, digital production does not eliminate cross-contamination, so it's important to understand how to use bio and non-biocompatible materials and understanding that they are each having their designated areas to prevent cross-contamination. Understanding every step can help guarantee an effective appliance and a successful technician who can fabricate for the needs of our patients. Thank you for listening.